We are the Criminal Justice Liaison and Diversion Service, so we work with any individual who gets arrested. So we start at police custody, we pick people up within the police custody, we follow them through to magistrates court, and then should they have committed a serious offence or require a trial, they then can be continued to be supported through the Crown Court process. The idea is that the individuals who may have any extra difficulties within the court process can be given and offered support.
So the role of the Lincolnshire Action Trust practitioners within the CGL&D service is that we work out of all 4 custody suites, so that's Lincoln, Boston, Skeg and Grantham, and we will do the predominant screening of cells, initial assessment, making referrals and supporting that individual through that custody process, and then referring them out into services in the community. Very similarly to the LPFT clinicians who also do screening and support and make referrals, but it's just the practitioners, so us, we don't support with the acute mental health, and that is all down to the trained clinicians, LPFT. I guess a few things we can and can't do along with that role is we can't go out into the community, unfortunately, so we can't go and attend doctor's appointments or anything like that, but we can refer into services who do that. So for example, Lincolnshire Action Trust mentors, various other services that work out in the community. We can't do what's called Mental Health Act assessments or fit to release, fit to detain that would take place in police custody. That is done by, again, trained professionals. So that's not done by the CGL&D service, either the practitioners or the clinicians. We can't do that. But yeah, we're basically just there to support people, to comfort them. It can be quite difficult being in custody, whether it's first arrest, fifth arrest. It's not a nice time for people. So CGL&D service as a whole, we can support people within that custody setting, find out what it is that might be going wrong for them, that might have happened to them in their past that has led them to here, and we can help support them to move forward into a more pro-social future.
We work with individuals from the age of 10 upwards, as that's the legal age for being arrested and detained. It's a case of seeing each person in their cell in the morning. We do what we call a cell sweep. And depending on the person and their level of risk and presentation at that moment in time, either the custody sergeant or one of the custody detention officers will open the cell door for us to go in and speak to the person. If that's not possible, it's done through the cell hatch, but either way each person is greeted by the person on shift. We explain what the Criminal Justice Liaison and Diversion Service can offer that person, which is support and onward referrals for help with mental health issues, drug and alcohol problems, housing issues, financial issues or other social issues. If the person accepts the offer of our service, we have them escorted from their cell into an individual interview room where we can sit in private. We conduct our thorough assessment of needs, which will highlight areas of difficulty and areas the person wants support with. We'll kind of formulate a plan going forward with that person, get them to prioritise. If there's a number of services required, we kind of get the priority one dealt with first. We would then make the referral to the service required. We maintain contact with the person in the meantime until they're hopefully accepted and assessed by whatever team we've referred to. We'll support that person through that process, and once they're engaged with the services, at that point we discharge them from Criminal Justice Liaison Service.
Helpful having CJLD because they can access systems and very often they will make us aware that someone who's presenting okay to us on the face of it have been under mental health services, and it can very often lead to us getting them extra help in terms of the provision of an appropriate adult and making sure that they're dealt properly with in custody.